This is Dr. Christopher Sendy with Nova Health Recovery Ketamine Infusion Center, and I'm going to discuss the process of ketamine therapy at Nova Health Recovery and how you get started and what exactly happens. So the first question is, what psychiatric conditions does ketamine therapy treat? Well, it treats several mental health mood disorders, such as treatment-resistant depression, and also it can be used with the initial treatment of depression when you're first starting your antidepressant, which sometimes can take many weeks to work if they work at all. Ketamine therapy is also effective for bipolar depression, suicidal ideation, anxiety disorders, post-traumatic stress disorder, and obsessive compulsive disorder, as well as grief reactions and several pain conditions. So this is kind of an algorithmic look at what the treatment process looks like. And so step one is the condition treatable with ketamine? And we just discussed, what conditions can be treated. And we mentioned a few of them, including adolescent depression, and specific addictions as well can be also treated with ketamine therapy, such as alcohol use disorder, opiate use disorder, and even cocaine use disorder in combination with other treatments. Now, step two is, are you medically able to receive the treatment? So if you have schizophrenia, if you have cardiac disease, a history of a heart attack or heart failure, especially within the past year, or unstable angina, if you've had a stroke in the past year, pregnancy currently, or if you have lung disease and are on oxygen, uncontrolled blood pressure or diabetes that's uncontrolled, or an active addiction disorder, or if you have kidney failure or liver failure, those are conditions which would need a medical clearance first. And we could certainly evaluate you for that to see if you're still a candidate for this treatment. And many people with these conditions still can get the therapy, but again, there are exclusions. And then step three is the medical intake and mental health preparation session. And in this, we do a mental health evaluation. We take a look at the journey that the individual has had through their mental health crises. And we also do a medical evaluation as well, taking a look at what medical conditions the individual has accrued over the years. Then we discuss the treatment, the risks, the benefits, expectations, and what the follow-up treatments are for ketamine therapies. We discuss how ketamine therapy works and the neurobiology of your condition, and also considerations for additional medical treatments that may actually have been left off the table that would really augment ketamine therapies as well as improve your outcome. And then there are also integrative treatments and treatment options and certain lifestyle changes that people also neglect to consider and also include in their treatment for their particular disorder. And we also address addiction and obesity issues as well, if those are problems. And then step four is the ketamine therapy process itself. And so if the individual is a candidate, then they would basically schedule a infusion time and potentially the same day as the consult preparation session. And the initial ketamine infusion is 0.5 milligrams per kilogram ideal body weight over 40 minutes, 2 or 3 times per week. And it's important to not go longer than several days between sessions, because as you wait longer and longer between single sessions, the effectiveness wears off. So the best findings are 3 sessions per week, like on a Monday, Wednesday, Friday sessions, and if necessary, maybe 2 times per week. But again, you want to get these relatively close together for that 6 infusion series. And you must have a driver, an individual to take you back and forth. Some people will Uber home. Again, you'll be awake during the whole infusion process for the most part, and the individual is going to be unable to drive though for about 4 to 6 hours after a treatment. And then after you've gone through the treatment process, and assuming that you've improved, which about 70% of patients who go through this process either get improvement or actually will get remission, then we would look at aftercare and aftercare boosters with home therapy. And at Nova Health Recovery, we use home-based oral and nasal spray ketamine for maintenance therapies. And those are generally low-dose, microdosing type ketamine therapies the individuals would do either on a daily basis or several times a week. It's, again, prescriptive. And then also, we recommend that the individual continue psychotherapy. Especially a ketamine-assisted psychotherapy is very useful. We'll discuss that here briefly as well. And then the periodic booster infusions. Generally, those are monthly. Some individuals will come in more frequently. It's at the individual's choice to come in more frequently. For some people, ketamine therapy is the only thing that ever works for them. And for others, the monthly boosters and sometimes even a little bit longer out work perfectly fine to maintain their mental health and mood disorder. And you do have to remember that depression is a neurodegenerative disorder. Once an individual's had one episode or two episodes, they're pretty much likely to have multiple episodes that will ensue over the course of their life. And then, of course, we also will continue to address lifestyle changes, make medication adjustments as necessary, and recommend self-monitoring for the person. And we use specific apps for the individual just to check moods and depression scoring, as well as we follow cognition. A lot of individuals complain of brain fog, and that could be monitored through specific types of neurocognitive assessments that we offer as well. So, how is the ketamine administered? Well, the fastest and most effective way is by IV infusion. And as we mentioned earlier, it's generally 6 infusions over 2 weeks. Usually 2 to 3 times per week, an individual will come in. And each infusion lasts 40 minutes at a dose of 0.5 to 0.75 milligrams per kilogram of ideal body weight over 40 minutes. We do use escalating doses as needed for effectiveness. And also, dissociation is not needed to achieve effect. And that's an argumentative point by a lot of individuals and other centers, and that they state that dissociation is absolutely required to get effect. And you'll see arguments on Reddit and elsewhere, but there are plenty of meta-analysis demonstrating no correlation between the two. But certainly if the individual finds that dissociation is helpful for them, we can assist them in that particular voyage that they want to go on. And many patients will describe the initial infusion as relaxing, unusual feeling, or calming, or immersive. So most people find this to be one of the most amazing experiences they've ever had, but sometimes the infusion experience can be a little bit anxiety provoking or even scary. And those actually can be very helpful infusions for people to work on after the fact with their therapists and find out what exactly bothered them and what points that they took away from the infusions and how they can change things. And just to let you know, you will be able to work the next day after the infusion. Most people, in fact, come to our office after work, and we generally have later hours to accommodate individuals to do that. And this is what a typical room looks like at Nova Health. This is with the lights down and dimmed. The individual just relaxes in the chair, which is, again, a recliner. They have ability to listen to either music that we use, or they can use their headsets, which we recommend that the individual bring noise-canceling headsets. Blankets are provided, although a weighted blanket is also very helpful. And then there's a number of different options for visual effects. So what about ketamine-assisted psychotherapy? And we hear more and more about patients requesting this, and their understanding of CAP sessions are, again, not entirely correct or accurate, and their expectations aren't necessarily well understood. And so we note that the preparation sessions for ketamine are given at the initial consult when we see patients at Nova Health. And we prep them and sort out their situations, their journey that they've had, and also where they've been and what future options that they will take away from ketamine therapies. But what a lot of patients expect is that there will be in-session sitting, in the sense that while the person's getting ketamine, that they'll actually be having talk sessions. And that can certainly be performed, and we do that at Nova Health Recovery, but only at lower doses, at psycholytic doses. The individuals can't be dissociated, because once you're dissociated and you're at higher doses, you just don't speak, you can't talk. You're having an internal journey. In fact, most individuals prefer to be alone. They prefer to be left alone so that their mind can just take that voyage on its own. And so an individual sitting there trying to barge in during that journey is actually quite alarming to the individual. It's actually quite intrusive. And so we also find that even group treatments, which in some centers are offered, are actually not very well received by patients. They get confused. They can't really focus on their inward journey. And so that said, again, in-session sitting can be done. And for those that feel anxious, certainly a sitter can be placed with the individual. And there are centers where they claim that they will be doing CAP sessions, but really the individuals aren't actually engaged in any type of conversation with the person at that particular time. And the other issue is that Again, your therapist knows you better, and it's very difficult for you to really make any headway with an individual that you don't know, and that won't be continuing on with your therapy sessions. And so, a lot of times, we have therapists who come in with their patients to Nova Health Recovery to actually conduct CAP sessions, both during and afterwards. And we know that basically ketamine assisted psychotherapy does improve outcomes, and that in general therapy improves outcomes. But the reality is that CAP sessions are primarily integration sessions, and these occur after the ketamine treatment, after the ketamine session itself, either that day, later that day, or the next few days after. So the most important time really to get that integration session to review what you've journaled during the session or after the session and what you took away from the session is actually the next day. And that's actually when the real CAP session should be done. And you can certainly do ketamine assisted psychotherapy immediately after the infusion is turned off as you start to kind of voyage back to reality, at which time then, again, ketamine would serve more as a lubricant to better therapy at that particular time since certain defense systems will be turned off. And individuals will also find that later on that the home-based therapy can also be used as a lubricant to better psychotherapy. So again, CAP therapy is really the engagement of integration after the infusion process itself. During the infusion process, most individuals can't or don't want to really be talking. But for those that do and find that helpful, having their therapist present during the session is great. Otherwise, we do provide therapy sessions at Nova Health. So how rapidly does the ketamine treatment work? Some patients will notice effects immediately. They'll feel more calm, they'll feel less sad, fewer ruminations. Others will actually start noticing more effect at the third or fourth infusions. But each person is different in their improvements. And you just need to know that improvement is non-linear. So there will be times where you feel better and times where you feel worse. And this can be very confusing to the individuals because when they start feeling better after a few sessions and suddenly one day they just feel worse, they may actually be better than their baseline. But from their perspective, they just can't really tell because one of the things that individuals who are depressed or have mood disorders is that they lose self-awareness, the ability to really see themselves for what's going on. And so anything less than feeling awesome can be catastrophically horrible for them, even though they're better than they were when they first started. And so we make sure that we tell individuals that there'll be days that you're going to have ups and downs. And that's just called moodiness for those that aren't depressed. And that's kind of the situation where people need to be in. But it takes time to accommodate yourself to a new, better homeostatic baseline. And so again, throughout this process, it's a non-linear improvement. And I kind of describe it like this. It's like your power in the house goes off and the modem goes off. When the power is restored, the modem starts to turn back on, and each of the lights comes on slowly and over time. And each of those lights represents one aspect of the individual's treatment progress. And so maybe for one, their happiness and sense of well-being improves, but then their brain fog takes longer, and then their motivation takes longer after that, et cetera, et cetera. And each one of those lights that turns on represents some other parameter of the individual as they improve. And just to let you know again about infusion experiences, they can be happy, sad, or neutral. Some people feel nothing at all, and others may feel like they don't even remember the infusion. So you can have amnesia, and you're like, oh my gosh, the infusion's already done. And others will have hypermnesia. They'll be like, I don't feel anything, and they remember more than ever before. And that's where basically they can recall every single event, even though they got the ketamine. And for some individuals, they'll have multiple infusions and they'll have them in a specific way and feel them in a certain way. And then suddenly they'll feel nothing at all in another infusion, thinking that somehow the therapy isn't working. But again, the actual events that occurred during the infusion don't represent what the outcomes will be. 70% of patients will notice significant improvement or remission during this treatment process. So by the end of the treatment series, about 70% of patients have some response or remission. And again, we don't know exactly who's going to improve and who's not. There are some parameters that improve or increase responsiveness, such as obesity and alcohol use disorder and a family history of alcohol use disorder. Those can increase outcomes in ketamine infusions, and people who have high levels of inflammation as well. Now, as far as the 30% who don't improve, it is possible that a lot of them actually have improved in certain parameters, but not the ones that they wanted to improve in. And some individuals do have self-awareness problems because they've been so depressed. Again, they have different parts of their brain that actually gauge how they're feeling. And so there's a lot more negative thoughts and still intrusive thoughts that kind of prevent them from seeing improvement until they actually stop the treatment. And so that's something we follow through with individuals as well, just to check up on them, just to see if they've found things that have actually improved as a result of ketamine therapies when they look out at it several weeks later. And how do we measure improvement? Well, it's measured in multiple ways, and a lot of them are medically validated scoring systems, such as the MADRS score, the PHQ-9, the Hamilton anxiety or depression rating scores, and a number of other methods as well that can be followed in office as well as online. So what happens after the initial series of the treatments? Well, Nova Health Recovery provides home-based oral ketamine troches, tablets, nasal spray for maintenance therapy. And these can be done either every day at really tiny doses. They aren't designed to give individuals a voyage. They're just designed for microdosing. And so individuals don't need to have a sitter. They don't need to be monitored. These are extremely safe and done in a prescriptive manner. And also recognize that because of the nature of depression, it is neurodegenerative. And again, you will need to have maintenance, just like you take your regular medications every day. Ketamine may also require booster infusions, usually on a monthly basis. Individuals are welcome to come back when they feel worse for any random reason. And there are individuals who come back frequently during the month when they have bad times during the year. And also, CAP therapy is really important. Some sort of psychotherapy or therapeutic process is necessary for follow through to basically continue the improvements that ketamine has offered, as well as lifestyle changes, also intervening on addiction and obesity issues, which we can also do. Also looking at medication options that may work better for the individual. Also looking at integrative health options, specific supplements, vitamins, and nutritional parameters that frequently aren't addressed. So again, ketamine therapy key points. We know that ketamine therapy works rapidly within days, and that ketamine is extremely safe in the treatment of mood disorders. It's administered as a series of 6 infusions over 2 to 3 weeks initially. Each infusion lasts 40 to 45 minutes, and doses can be escalated with each treatment. The most common side effect during an infusion is nausea, for which we give prophylactic antiemetics. The second most common experience is dizziness, which goes away within a few minutes after the infusion stops to within an hour or two. And that's one of the reasons you can't drive for 4 to 6 hours after the treatment. Ketamine therapy outcomes are best when psychotherapy is actually performed in terms of integration during ketamine sessions, and also that low-dose oral and intranasal ketamine can be safely used at home for maintenance therapy as well as for lubricating the psychotherapy process. And so again, ketamine does treat severe depression, treatment-resistant depression, PTSD, OCD, bipolar depression, suicidality, anxiety disorders, and certain pain conditions, as well as several other conditions. And so that said, we also have a process for ketamine therapy for home use as well. For those that don't feel that they can tolerate the IV formulations or can't get a ride or fear needles or other reasons, and for those with milder conditions. And again, the IV formulations work best and fastest in terms of getting the person to a rapid baseline state. Home-based therapies actually take a lot longer for them to work. And if they don't work well for the individual, it doesn't mean that ketamine doesn't work. It just means that they may need to have infusions to basically improve their outcomes dramatically. And so that said, we do offer home-based ketamine therapies using a similar protocol and a similar intake phenomenon as well at Nova Health. So why consider home therapy? Home therapy works best as a maintenance strategy after the initial infusions and between booster infusions. There's not much of a psycholytic effect if it's microdose. So in other words, you won't feel much of a journey, if any at all. And ketamine home-based therapy can be used in very low daily dosage as oral troches and tablets to kind of maintain mood at a better level. And this can also be used again to lubricate the psychotherapy process, but also as an initial therapy as a form of home therapy to augment your current antidepressant treatment, especially if you're mildly or moderately depressed and you can't find a way to get IV infusions. But again, it's not as effective as ketamine infusions and not as rapidly as effective as ketamine infusions. So again, we get 100% bioavailability with the IV therapies and only about 20% with oral therapies. Nasal therapies about 40 to 50% for each dose. And again, this is an extremely safe treatment. So again, is ketamine safe? And yeah, ketamine is safe. It's effective. It's well tolerated. It's been in use since 1970 when it was approved for anesthetic purposes. In sub-anesthetic, low doses, ketamine treats mood disorders, whereas in higher doses, anesthetic doses, it actually is just used to basically put individuals to sleep for surgical purposes. So the doses used in mood disorders is a fraction, a tiny fraction relative to the anesthetic dosing. And when we're in the office, we're using moderately higher doses relative to the home therapies. We monitor individuals with blood pressure and heart rate and oxygen saturation measurements. But again, ketamine is very well known to have minimal impact on vital signs. And any changes that occur with heart rate or anything else for vital signs immediately goes back to normal after the treatment is done. Now, as far as abuse and misuse, there certainly is a potential for that, and certainly ketamine has been used and known to be used in the context of raves and in party situations, especially in Southeast Asia, at super high doses. But it's been noted that a physiological withdrawal state is not present at medical dosing. And basically at monitored prescribed medication doses, ketamine is very, very safe. In fact, it's on the World Health Organization's essential medication list since 1985 as one of the safest drugs on the planet. And then as far as ketamine being used in the street as special K or horse tranquilizer, which makes it sound way too powerful for human consumption. But again, at any high dose, any medication is a problem. So at appropriate medical doses, ketamine is extremely safe. And of course, street ketamine is frequently not what people think it is. A lot of times it's cut with other substances such as MDMA or fentanyl or cocaine or whatever. And so at very high doses, actually, it is actually not an antidepressant. And frequently when people snort street K, they get a totally different effect. And it's individuals who are doing that also are less likely to have depression or mood disorders, but rather just be doing this to have fun. And there is a difference between ketamine use when you're depressed versus when you're not depressed. Two totally different experiences. One thing is that if an individual decides to stop ketamine, there is no physiological withdrawal state present. But the only thing is that you must recognize that the only thing that may happen is that you may have a return of depression when you stop doing the ketamine therapies over time.